Dr. Andrew Yun with Dr. Ken Sachs, Chief of Anesthesia at St. John's, and we're just going over some frequently asked questions, some of the concerns our patients often ask us. Can you tell me a little bit about the safety of anesthesia?
Certainly. So anesthesia is made quite safe in a variety of ways. It all starts actually with the evaluation that you get at the surgeon's office, where he actually takes a medical history in addition to taking a history about your joint that needs to be replaced. Then you also see your family doctor or any specialty consultation doctors that you have, and they also prepare you for anesthesia. So by the time you come to the hospital, we have a tremendous amount of information about a patient, and then the anesthesiologist is able to formulate a plan for their anesthetic. Then during the surgery, we monitor all vital signs of the patient. That might include your heart rate, pulse, your oxygen levels, the anesthetic levels, your temperature and blood pressures, and every aspect of all the other vital signs. This is done continuously, and the anesthesiologist is present with you at all times. So with all this monitoring and all this preoperative preparation, anesthetics are quite safe.
They do seem much safer than they appeared historically, and these are much shorter surgeries. Can you comment on the benefits of that as well?
Well, obviously, the shorter a surgery, the less anesthesia you need. The anesthetic risk goes down quite significantly.
Tell me a little bit about the risks of anesthesia. Some of our patients are concerned that they might be too old for an anesthetic. What do you say to that?
Well, actually, surprisingly, no patient is too old for anesthesia. In fact, elderly patients have the same risk profile as younger patients if they have the same medical history. So in general, we do not look at an elderly patient and are unduly concerned because of their age that they shouldn't have an anesthetic. It really comes down to more about their specific medical histories and their medical status.
Some patients are also just worried about the effect of anesthesia in their overall health. Maybe they feel that they're too unhealthy. They have issues with obesity, high blood pressure, diabetes, just a lot of pre-existing medical conditions. Tell me about the safety of anesthesia in that type of patient.
Well, even patients with complex medical histories can have anesthetics and have them done safely. Where we take extra precautions with these patients is that frequently we'll send them for additional consultations before they even come to the hospital. So it's called medical optimization. And what we do is, they see their family doctors. We determine if they have a complex medical history, if they need additional testing, additional specialty consultations, and then we make sure that all their medical conditions are tightly controlled, well treated, and then the risks of their medical conditions go down just as a result of better preparation. In addition, the anesthesiologist then tailors his anesthetic to their medical conditions. So between better preoperative preparation and a more specific anesthetic that is tailored to specific medical conditions, even complex medical patients can undergo a safe anesthetic.
Yeah, and that seems to be the case. There are two concerns that we typically hear in the office, and so I thought you would be the best person to answer this. One has to do with the issue of anesthesia and long-term memory loss, and the other has to do with patients are just afraid of dying in anesthesia. Would you mind commenting on both of those?
Sure. So there actually, for memory loss, there have been multiple studies that have examined memory loss, long-term memory loss, and even memory loss in elderly patients. And there has never been a determination that anesthetics have caused long-term memory loss in patients.
And then what about this common concern, morbid concern of just dying in anesthesia?
Well, I feel like everybody has that on some level. It's very similar to the sort of concerns you can have when traveling in a car or taking any sort of risk at all. But anesthetic deaths are very rare, extremely rare. They usually occur in people that have multiple medical problems that are poorly controlled, and in patients who have not been well prepared for surgery. And the incidence or frequency of a death is exceedingly rare. One could liken it to one person having an anesthetic death in a very large city. That's the sort of frequency in which it occurs. It's very uncommon.
Yeah, and anesthesia seems so much safer nowadays with the new medications, with the instrumentation, with the monitoring, as well as some of the advances we made on the surgical side.
Well, indeed, in fact, it is the anesthesiologists and the anesthetic subspecialty that's trailblazed safety in medicine for the last 20 years. So they did actually improve the profiles of the medications, which are much shorter acting, have a lesser effect on the patient's physiology and overall being, and as well the monitoring is much more accurate.
So with these types of concerns in mind, what would you say to a patient who is really afraid of facing anesthesia?
Well, the thing that I do when I see a patient who's anxious is I interview them to understand what their specific anxiety is. And then we go over the measures that we can take to help soothe their anxiety. And usually a good explanation can make a patient anxiety-free just by a little bit of communication and a tincture of time during the initial consultation.
Great, thank you.